Public health nurses play a major role in all phases of disaster response. As in this case scenario, if a tornado were to touch down in the Casper Park and Acer Tech districts of Sentinel City, significant damage would be done that would take months or years to fully recover from. In these neighborhoods, there are a wealth of businesses that would sustain damage, as well as the city's hospital, Sentinel City Healthcare System, City Hall, the Community Center, ABC Daycare, and the Affordable Housing Project. The many buildings in this area could collapse or sustain severe damage, causing death or entrapment of the people in or near them at the time of the tornado. Downed power lines pose very real threats in many ways. They can electrocute residents depending on where they land, and they can fall across roads, making them impassable to emergency personnel. Roads can also be damaged simply from the tornado's high winds, making them more difficult for emergency crews to travel, as well as making travel difficult for residents to evacuate if necessary. Scattered debris can make search and rescue difficult. Public water systems can become flooded due to tornado damage, possibly making the water unsafe to drink or bathe in. Gas lines also become damaged, causing potential for fires, causing further damage to homes and businesses. In addition to these potential health effects to public health and the environment and infrastructure of the city, many injuries or deaths can be sustained from the tornado. Most deaths from tornadic activity occur at the scene and result from severe head injury, cervical spine trauma, or crush injuries. The most common injuries sustained from tornadoes are contaminated soft tissue lacerations, which account for 54% of injuries, and fractures, which account for 30% of injuries. Others include blunt trauma at 7%, another 7% are head injuries, and 2% of injuries are minor strains. Members and organizations of the emergency management team that will be activated include the head of the local municipality, which would be Mayor Hill, the city's public health department, specifically the department's emergency response coordinators, environmental health specialists, safety and health specialists, and medical examiners or coroners. Emergency personnel, such as the police and fire departments, along with paramedics and emergency medical technicians, would be among the first to the scene to begin assessing and triaging. The Sentinel City Health System Emergency Department, if it did not sustain considerable damage itself, would be notified and utilized. In addition, utility companies may need to be utilized as part of the emergency management team to emergently tend to gas, electric, or water lines. Some private and public resources which would assist with the response have been discussed already. In the short term, police and fire departments, EMTs and paramedics, the Sentinel City Healthcare System, and public and private utility companies would be providing assistance in the short term for effects from the tornado. For long-term assistance, government agencies such as the National Guard, CDC personnel, persons from the Federal Emergency Management Agency, or FEMA, the U.S. Department of Health and Human Services Incident Response Coordination Team, and the National Disaster Medical System teams, along with volunteer organizations like the Red Cross, would be asked to aid in the management, recovery, and rebuilding of the affected area and residents. In the technological age we are living now, social media is a large part of everyday life. During and after a disaster, the public have very quick responses on social media, which can both help and hurt the immediate situation. The risks of posting about a disaster on social media. False information can be very easily spread, and messages can be manipulated. In addition, something that I realized when a tornado touched down near me in Wilkes-Barre, Pennsylvania just last month, in June 2018, social media can exacerbate things like looting. When images and videos are so quickly spread about businesses that are damaged, that's an easy way for thieves to find their opportunities. On the other hand, there are several benefits to the easy access to information that social media supplies. Persons managing the emergency or disaster, such as the city's mayor or a public health official, can get out information for public knowledge, such as road closures, areas of the city to avoid, locations of shelters, and where and how to locate supplies or other help. Social media is also successfully used by the general public to send and receive information to and from loved ones about their status and to help locate each other, and reporting areas of the city that are in need of support. In addition, social media has often been used to gain more aid for badly hit areas in a disaster. Other people from around the country or the world can see just how much the city may be in need, and pages can be set up for strangers to donate money or supplies and to help people get information on traveling to the affected area to volunteer with cleanup.